I'd like to talk to you about a new mobile pain treatment program for neuropathy available now in California. So, a lot of you out there watching this, you may already have neuropathy pain. You know that there are a lot of symptoms involved with neuropathy, pain, burning, tingling, and numbness. So, there are also very few options for this treatment. Most people are familiar with just having a few different types of medications. That's about the only thing that most doctors can do for patients. Pain management doctors and primary care doctors are typically managing patients with chronic peripheral neuropathy pain, and they typically do that with prescription meds. It's about all there is. There's a few other more invasive procedure options out there, but really there's not a lot. The other aspect of this too is that when you actually do have neuropathy pain, it becomes very difficult to get around, right? To travel, go from your house to the office. All those scenarios make it very difficult for a patient to operate who has peripheral neuropathy pain. So obviously, California is a large state. So when we say we now have mobile service available for treating neuropathy in California, there are obviously certain areas where nurses are available for that. But in general, our program is a program where the nurses will come out and actually treat you in your home using what's called neurofunctional pain management. That is the treatment modality for treating chronic peripheral neuropathy pain. So this program, it consists of three different items, three different pieces, if you will. One of those is called electroanalgesic therapy. The other one is IV nutritional hydration, and the third one is health coaching. So the first of those three, electroanalgesic therapy. This is a treatment that's been around for 35, almost 40 years as an FDA cleared modality for treating pain. A lot of doctors actually know what it is. Most doctors do not know what it is. So it's kind of a hit and miss on who actually knows anything about this actual category. If any doctor who's in the field of neuromodulation and pain management, they probably actually have heard of it, but you'd be very hard pressed to find a doctor who actually uses it. And the reason why is just it's just not really suited for most doctors' practice models. And I'll explain very quickly why. So before I explain why it's not suited, going back to what it actually is, it's high pulse electrical currents, but they are administered in a way that's powerful enough to actually cause an effect on your nerves. So one of the first comparisons people will make is say, "Oh, that's kind of like a TENS unit." Well, kind of, but not really. A TENS unit is a muscle stimulator, and a electroanalgesic therapy is a neural stimulator. So it's actually stimulating the neurons, it's depolarizing your pain neurons that inhibits and it reduces and inhibits the flow of pain signals to the brain. If you can interfere with that pain cycle, you can actually start to de-escalate that pain inflammation cycle. Most people are familiar with if you have some pain, you have some inflammation, which then triggers more pain, which triggers more inflammation. You have this cycle. And a lot of treatments and medications and therapies are out there. They're designed to try and interfere with this model, this pain inflammation cycle. So that being said, that is the typical issue that doctors are dealing with is trying to find a way to interfere or slow that down. So electroanalgesic therapy actually very successfully interferes with that to the point that it has a very high success rate. And I'll explain that here in just a minute. But the other aspect of this is that when I mentioned a second ago that it's depolarizing pain neurons, it will actually release a range of neurotransmitters and neuropeptides during this process. Endorphins and enkephalins and GABA and a few other things like that. Though that triple combination of neuropeptides actually really helps in that pain relief process. A lot of people would describe those neurotransmitters as being the key ingredients of a runner's high. It's how someone feels great and good after they go for a run. That's kind of how this would make you feel in general after getting treatments. So, but on top of that, it's interfering with the actual pain transfer. So that's another aspect of value. So both of those aspects of this treatment actually work to relieve chronic pain. So the second component of this is the IV hydration therapy. It's a nutritional hydration therapy. It's vitamin and mineral mix. It's very simple. Most patients can have this IV and take this IV. So that there's a very I guess, synergistic effect of doing this IV in combination with the electrical therapy that really assists in the pain relief aspect of this. So most chronic pain patients are chronically dehydrated, chronically nutritionally deficient in a few different vitamins and minerals. So the IVs really do help, and patients really do get out of pain. They typically get out of pain faster. They typically have a greater pain relief outcome, and they typically will last longer afterwards. The duration of effect will last longer. And then the third component of the program is health coaching. A lot of people are saying, oh, well, I know what's healthy and what's not healthy to eat. Well, that's all health coaching is. There's a lot more to it than that. Most patients that are in a state of chronic pain typically are also in a state of I don't care. I'm losing hope. I'm in pain. Nothing matters. I've seen a lot of that. A lot of doctors have seen that. Not a lot of enthusiasm about trying to get healthier and just overhaul their diet and exercise and lifestyle, right? But the moment you start getting out of pain from something that actually works, like this, all of a sudden there's a little spark of hope there, and suddenly that's worth making some changes for. So I've seen this happen hundreds and hundreds of times, where a patient starts getting out of pain, and then they start having this motivation to actually get healthier. They start that there's a light that you see, out of this pain tunnel, and they start getting very excited about being healthy all around. I'm going to start eating better. I'm going to start getting some exercise and drink more water and get better sleep. By the way, one of the positive side effects of this treatment is better sleep. Most patients will end up saying that's the first thing that they notice, that they sleep better at night. Sometimes because the pain is gone, other times it's because of the release of all of the neurotransmitters actually helping to assist in a very deep sleep for patients, helping them actually get good sleep. So those three things are the combination of neurofunctional pain management. So how effective is it? Over the years, we've worked with a lot of doctors doing this, and we will always ask them what do they think is their effective outcome, like their success rate. And 85% across the board. That's the average. That's where most doctors are landing with this. And I've had a few doctors who would say that almost begrudgingly, like, yeah, it's actually 85% for this, when the other stuff that they traditionally do don't get near that, right? Like they've been doing all these spinal injections and all these interventional procedures, and they don't have 85% success rate with all these different pain conditions. We're talking about, when I say 85%, we're averaging about 24 different types of pain, everything from peripheral neuropathy to every type of joint pain, chronic back pain, fibromyalgia, sciatica, knee osteoarthritis, knee pain. We're talking about all of these kinds of pain, and the average is 85%. It's very rare that you would find anything else in the world of pain management that would actually work that well for so many different types of pain conditions, but this does. And we've seen it happen with hundreds and hundreds of patients. So that being said, 85% successful. And the key metric here is the doctors, they classify everything as there's an objective to the treatment. And so they're saying that their objective is to have a greater than 50% reduction. Well, that could mean all the way to zero, right? From if you're on the pain scale of 0 to 10, and they're saying that they want to see a greater than 50% reduction, all that means is that they want to see at least half of the pain subside, and that's considered a success, or greater, which could be all the way to zero, right? So they have no pain at all. The patient's perfectly happy, but that patient, greater than 50% is considered successful. And that's what our 85% model is. I would say probably just ballparking this here, somewhere between 30 and 40% of all the patients going through are going to have fully resolved or nearly resolved pain. So basically completely out of pain for the most part. And it works for them so well that they're just out of pain and they're going around doing everything in life. How long does it last? Another question we get a lot. So the anticipation, what we've seen with hundreds and hundreds of patients, and what we believe we can aim for is 3 to 6 months of ongoing relief. I say ongoing, meaning wherever you landed at the end of that treatment program, we expect that to last for another 3 to 6 months. If you've done the IVs with it, you will typically see better and longer lasting outcomes. The health coaching, it becomes very important when we're talking about duration of the outcomes, right? Because you've gotten out of pain, you've started being better, but now if you can maintain some good lifestyle overhauls, some good diet, some good exercise, and things, you can actually increase the length of time that all this does work. And so we really encourage patients to get really involved in that health coaching model, because there's goals, there's objectives, there's all sorts of ways to help you get healthier, and that's all going to help this last longer. 3 to 6 months is the objective. How many times have I seen this go over 6 months? Hundreds. I've probably seen hundreds of patients out of the thousands, maybe tens of thousands. I've seen many hundreds of patients go between 6 and 12 months. I would probably shouldn't say thousands, but it probably could have been thousands that actually lasted that long. But 6+ months, definitely see that. I've actually had plenty of patients that come back in saying that at the year mark, saying, yeah, it's been about a year and my pain's starting to come back now. It's been, lasted most of the year, the success rate. So a lot of patients will see this last for a period of time. It'll start to slowly come back. So that's also kind of the benefit, is that you have the 3 to 6 months duration, and then it starts to slowly come back, which might take months for it to actually get back to where it was, the bad pain when you started. So there's typically quite a long time of successful outcome. So that being said, treatment program, it is 8 weeks long, 2 treatments per week, 1 hour each treatment, right? And the nurse is coming to your home and doing it there. One of those treatments is a combination electrical IV combined during that visit, and the other treatment is electrical only. So the nurse will come out and put the electrical system on you and run that program, but then there's no IV on that day, but there is on the other day. So you're getting 1 IV per week and 2 electrical treatments per week. Each event is an hour long, so the nurse is there with you for an hour. While they're there with you, they're going to talk to you, do the health coaching with you, and they're going to get to know you, and you'll get to know them, and most likely you'll become their friends. And I have seen a lot of nurses and patients become very, very, just, there's an emotional component to this. When you're getting out of pain and you're helping someone get out of pain, the nurses do have a very strong relationship with you. And a lot of times the patient will see the nurse who's helping you get out of pain as being a hero in a lot of ways, being a hero for them. You actually did something that no one else could do. Out of all the doctors that they'd worked with for sometimes decades, and I know this, I have seen patients who have had these pain issues going on for decades. And after decades, and maybe even dozens of doctors, but many doctors and decades, nothing has worked. And suddenly this does, right? And that's impressive, that's exciting. And the patients do see their nurses a lot like a hero that's coming to their home and offering this treatment program. So that is the overall premise of the program. To top it all off, yes, this is covered by Medicare and commercial insurances. The way that it's structured is a very simple treatment model. It's considered conservative therapy in the world of medicine and reimbursement models. So it's very easy for this to be approved to be covered by Medicare and commercial payers. Typically, our company doing this, the RELATYV Mobile Pain Treatment Program, and it's using the Neurogenics NFPM program, and NFPM is neurofunctional pain management. So we're using the NFPM treatment model, and we're actually the RELATYV Mobile Pain Treatment Program. It's RELATYV is the platform we use for this, the company itself. But that company is going to do an insurance verification for you and just take a look at what your benefits are, because everybody's got different plans, all these different things. And I know a lot of you out there thinking, I've got Medicare, I'm covered. Well, not all Medicares are the same now. It's, I think, something like 20% of people actually have the original Medicare plan. Everybody else has got some other version of it. There's hundreds and hundreds of Advantage plans and things out there. So just, everyone's got to get a verification done, take a look at what your current, insurance plan says about your treatment. But for the most part, we have seen almost everyone who has wanted to get treatment, we've seen them be able to get this covered to some degree in some fashion, right? So as a covered treatment, we encourage you all to take a look at it, see if this is something that can actually work for you. And on top of all of that, did I already mention this maybe once or twice, that this is actually coming to you in your house? You do not have to leave and go to the doctor's office to get this done. You can actually have the nurse come out to you, and it's still covered and paid for by your Medicare and insurances to have it done at home. So we are excited to work with you. We want to get you out of pain. We want to make this work. Uh, I have a link to our site in the description of this video. I'd be very happy for you to just click on that, take a look at the site, and actually fill out the insurance form. Let us get started checking to see what we can do for you. Take a look at our map and see if we have nurses near you, and reach out to us. Reach out to us. Fill out the form online. Say hi to us. And if we don't have a nurse around you, we'd love to put you on our wait list for when we do get nurses, because we're onboarding nurses constantly and bringing them on and getting them started, and hopefully we can get someone near you if we don't already have someone. I say all that because I know California is a very large state, so a lot of you out there watching this are thinking, yeah, you have a mobile program, but it's not available, everywhere in the state. Well, that's a big state. So that being said, I encourage you to fill out the form. We look forward to working with you. Thank you so much.